Hello, Dr. Davis and my fellow classmates. My name is Allison Symes, and I will be presenting my presentation today on special populations and mental health. In this presentation, I will be discussing the mental health needs of special populations, including the elderly, pregnant women, adolescents, LGBTQ, and immigrants. The elderly population in the United States includes men and women who are at least 65 years or older. This population is growing rapidly due to increased life expectancy and aging baby boomers. According to the National Council on Aging from 2024, by the year 2030, it is estimated that 1 in 5 Americans will be 65 years or older. This will cause the elderly population to roughly increase to around 78.3 million people. Most older people have at least one chronic health condition, and many are dealing with multiple health issues as well. The United States epidemiological data from 2022 shows that the most common health conditions elderly people are living with include heart disease, arthritis, diabetes, and obesity. In a study conducted from 2021 to 2022 by the American Psychiatric Association, they stated that an estimated 1 in 8 older adults had a mental illness, and 1 in 11 had a substance use disorder within the past year. Older adult females were more likely than males to have a mental illness, while males were more likely than females to have a substance use issue or disorder. Economic insecurity is a crucial issue for elderly adults. Among Americans aged 65 and older, 10.2% or 5.9 million live below the official poverty line, with 14.1% meeting the poverty line definition according to the United States Census Bureau data. I'm going to move on. As people age, our bodies change in ways that may not always be so obvious. By keeping up with doctors regularly, this not only helps to treat illnesses, but also helps elderly adults maintain their independence and quality of life. This can be done by recommending routine screenings for dementia, depression, anxiety, mobility, social support, isolation, substance use, cancer, bone health, vaccinations, nutrition, and even sleep quality. Medication absorption is often unchanged or minimal, but elderly people do have a slower gastric emptying time, which can delay the onset of medication action. A decreased glomerular filtration rate and creatinine clearance, even with normal serum creatinine, so drugs stay in the system longer than desired. Dose adjust drugs that are cleared via the kidneys, for the elderly specifically, use the Crocroft-Gault equation to estimate creatinine clearance, which allows a more accurate estimation of kidney function. Anticholinergic medications worsens cognition, constipation, urinary retention, and falls in the elderly. They have increased central nervous system sensitivity to sedative, anticholinergic, and antipsychotic medications. There is also a higher risk for orthostatic hypotension in the elderly. Hydroxyzine, which is a first-generation antihistamine, should be avoided because this medication can lead to anticholinergic effects. Avoid or be cautious when prescribing benzodiazepines, as this can increase falls, delirium, cognitive decline, and dependence in the elderly. Oral non-steroidal anti-inflammatory drugs, or also called NSAIDs, are commonly used by older adults and are easily made available to them with or without a prescription. However, older adults are more prone to adverse effects of this medication class. NSAIDs used by older adults can cause GI bleeding, decrease renal clearing, raising drug levels, and increases the risk of cardiovascular events. Use GI and renal monitoring to determine if there is a medication that might be safer to use in the elderly population. Consider topical creams for inflammatory pain, or acetaminophen for pain relief instead of NSAIDs. Collaborative care strategies to use when working with the elderly population are to explain things more slowly and allow extra time to process new information. For the visually impaired, consider using paper handouts with large sized print, or utilizing good lighting. For auditorily impaired patients, consider raising your voice, talking slowly, and facing the patient when speaking to them. Summarize and write down key points that were discussed during your appointment, and so that they can refer back to them. If consent is obtained prior, encourage caregivers to accompany patients during appointments so that they can also listen in to the plan of care. Moving on. In the United States, maternal morbidity and mortality is on the rise. The United States has experienced rising rates of pregnant women dying over the past 3 decades. In 2021, there were 1,205 maternal deaths, equating to a maternal mortality rate, or MMR, of 32.9 deaths per 100,000 live births. According to the United States Centers for Disease Control and Prevention, in 2023, the fertility rate was 54.5 births for every 1,000 live women who were between the ages of 15 and 44. The number of births recorded was 3,596,017, and the birth rate was 10.7 for every 1,000 women. Really low. Studies have documented an association between maternal postpartum depression and negative economic outcomes after childbirth. Short-term risk factors include an increased incidence of household food insecurity, housing instability, and missed workdays. Long-term risk factors were unemployment and poverty for many years later. Moving on. Routine assessments for pregnant women should include vital signs, BMI, nutritional status, and for pregnancy-related symptoms. Blood tests commonly run are blood typing, Rh factor, CBC, glucose, and non-invasive prenatal testing, infectious diseases, ultrasounds, urinalysis, substance abuse screening, depression, and anxiety screenings. The American College of Obstetricians and Gynecologists recommends that all perinatal women be screened for mental health conditions during pregnancy. If they are found to be positive, resources such as psychosocial therapy and relaxation techniques should be offered. If a pregnant woman is depressed perinatally, she should also be assessed in the postpartum period at least once, and resources offered if present at that time. The goal of medication administration for pregnant women is to generate effective but non-toxic exposure to medicine in the body. This means that the plasma concentrations of a drug should not be too low, which may make them ineffective, or should not be too high, which may lead to toxicity to the mother and the fetus as well. With nausea and vomiting of pregnancy, this limits the desire to take medications, as well as reduction of the drug itself when it's expelled from the body. A slowed gastric emptying time leads to a decrease in drug concentration in the body. Pregnancy increases the total body water and plasma volume in the body. This increases the distribution of hydrophilic drugs and often leads to reduced therapeutic efficacy. Similarly, the state of pregnancy increases the percentage of body fat in the body, which increases the volume of distribution of lipophilic drugs. This results in lower serum concentrations of the drug within the body, leading to reduced effectiveness of a standard dose. Contraindications with pregnancy and treatment. Some antibiotics are considered safe in pregnancy, while such as penicillin and cephalosporins, while others increase the risk of congenital defects in an unborn child, which includes sulfonamides and tetracyclines. Isotretinoin can increase the risk of an infant developing serious congenital defects by between 20 and 35%. NSAIDs can lead to serious kidney complications in fetuses, such as miscarriage or fetal heart abnormalities. Anxiety medications, such as sertraline or Zoloft, are linked to pulmonary hypertension and other defects in newborns. Pepto-Bismol can result in fetal salicylate absorption and can lead to fetal bleeding, reduced weight, perinatal mortality, as well as prolonged labor. Collaborative strategies for the pregnant woman. Pregnant women are especially those with chronic medical conditions, need to be educated on the risks of taking medications during pregnancy. Strategies to encourage collaboration can be to enhance communication between patient and provider, share decision making regarding risks, and coordinated care across various specialties. Psychotherapeutic options. You can, for the pregnant woman, you can encourage the patient to meet with a licensed therapist or counselor if needed. Ask for help and don't try to do everything on your own. Maintain a healthy diet during pregnancy. Exercise regularly if you can. And don't make any major life-changing decisions, if possible, during this time. Adolescents, which includes young boys and girls from about the age between 10 through 19 years of age. There are 42 million adolescents currently living within the United States today, which makes up more than 13% of the U.S. population. In 2023, more than 5.3 million adolescents aged 12 to 17 years, which is about 20.3% of adolescents, had a mental or behavioral health condition, such as anxiety, depression, or behavior or conduct problems. Anxiety was the most common condition at 16.1%, followed by depression, 8.4%, and behavior or conduct problems at 6.3%. A greater proportion of females had diagnosed anxiety, 20.1% versus 12.3%, and depression, 10.9% versus 6%, while a greater proportion of males had diagnosed behavior or conduct problems, 8.2% versus 4.3%. Of the total number of adolescents who experienced a major depressive episode in 2021, only 39% received care. The ripple effects of the adolescent behavior health crisis is estimated to cost up to $185 billion in lifetime medical costs and $3 trillion in lifetime lost productivity and wages. Adolescent assessments or screenings can include the pediatric symptom checklist, 17 or 35 items on that checklist. GAPS stands for the AMA guidelines for adolescent preventative services, which are a comprehensive set of recommendations to organize preventative health services for adolescents. HEADS stands for home, education or employment, activities, drugs, suicidality, suicide or depression, and safety. This screening framework is used to identify any adolescents who are at risk of substance use, sexual health, or mental health concerns. Screenings for adolescents should include physical exams, mental health assessments, sexual health, and also substance use screenings. Examples of mental health disorders to consider in adolescents based on the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, are ADHD, adjustment disorder, anorexia nervosa, bipolar disorders, conduct disorders, generalized anxiety disorder, insomnia disorder, intellectual disability, major depressive disorder, obsessive compulsive disorder, obstructive sleep apnea, and oppositional defiant disorder. Children experience large amounts of growth and development during early childhood, which can dramatically affect the pharmacokinetics of different drugs. Dosage regimens based entirely on age are often inaccurate and may lead to adverse effects, toxicity, or lack of clinical effect. There is a lack of pharmacokinetic studies in children of different ages currently. Weight-based and surface area-based dosing regimens are simple and are used in most clinical situations. Many doses are given in milligrams per kilogram, so knowing the child's weight in kilograms is important. Usually the calculated dose should never exceed the adult dose. Obese children can be dosed using ideal body weight and the dose adjusted based on clinical effect. They are at a higher risk of toxicity from drugs such as paracetamol that do not distribute into fat. If actual weight is used to calculate the dose, it can be much higher, so they can actually overdose on that if they don't use the ideal weight for obese patients. For levetiracetam, a commonly used anticonvulsant for children, they experience increased clearance of this medication. For this reason, a higher milligram per kilogram dose is required in patients up to 12 years of age. For methylphenidate, a commonly used medication for ADHD, in children has a decreased clearance as well. The other one was higher. There's a decrease in clearance. In this case, lower doses are required in children who are between the ages of 6 and 12 years of age compared to older adolescents. So some medications you might need to go higher, some medications might need to go lower, depending on how that drug itself works in the adolescent's body. Collaborative strategies that can be used are school-based services, community and system partnerships, confidentiality, social determinants of health and empowerment. Psychotherapeutic options that can be used are cognitive behavioral therapy, interpersonal therapy, fostering of improved self-esteem, and changing negative behaviors and mindsets. For LGBT, a recent polling of 14,000 adults showed that 9.3% identify as LGBT+, 5.2% identify as bisexual, 2% as gay, 1.4% as lesbian, and 1.3% as transgender. When applied to the national population of 341 million people, this would be equivalent to 31.7 million LGBT plus adults, including 17.7 million bisexual people, 6.8 million gay people, 4.8 million lesbians, and 4.4 million transgender people. LGBTQ plus populations in the United States present poor health outcomes, both in terms of physical and mental health, compared to the cis heterosexual population. The LGBTQ plus community has higher rates of mental health problems such as depression and anxiety, substance abuse, including the use of tobacco, alcohol, and other drugs, as well as suicide. While there is existing research linking financial hardships and mental health conditions among the general population, there is little research that has examined associations between financial hardships and mental burden among people of the LGBTQ plus populations. However, according to Ring 2025, experiencing food insecurity is associated with a 69% greater chance of experiencing depression, 68% greater chance of experiencing anxiety, and 60% greater chance of considering suicide, and 71% greater chance of attempting suicide in the past year. So, mental health screenings can be beneficial for the LGBTQ plus population because this allows providers to spot early warning signs that can limit negative mental health consequences like anxiety, depression, suicidal thoughts, or actions. LGBTQ plus people, especially men who have sex with men, have greater incidence of STIs. Even though medical treatment and prevention for HIV and STIs has improved, regular testing is still recommended for such a high-risk population. For the transgender population, patients may have taken hormones, which increases their risk of developing some cancers, especially if they have HPV or HIV. Regular cancer screening should be encouraged in the LGBT population, which will hopefully allow cancers to be caught early, making them easier to treat. In the DSM-5, considerations for people with LGBTQ plus community are gender identity disorder, gender dysphoria, anxiety or depression disorders, substance use disorders, post-traumatic stress disorder, or suicidal behavior disorder. Transgender adults have a gender identity that differs from their sex that was assigned at birth. However, clinical pharmacological data are lacking for this population. For people undergoing gender-affirming hormone therapy, or GAHT, fluctuations in body fat distribution may increase the volume and distribution for lipophilic drugs and alter drug clearance rates, potentially leading to faster clearance of medications in individuals assigned female at birth compared to those assigned male. Individuals who are assigned male at birth generally exhibit faster renal processes such as glomerular filtration, tubular secretion, and reabsorption, which can further modify drug metabolism. Contraindications to GAHT include severe pre-existing conditions like thromboembolic diseases, mainly if untreated, hormone-sensitive tumors, arterial hypertension, and epilepsy. In the presence of elevated liver enzymes, a pre-existing hepatic condition should be ruled out, and further diagnostic testing may be required. GAHT may be associated with erythrocytosis, weight gain, acne, alopecia, and sleep apnea in masculinizing hormone therapy. In feminizing hormone therapy, side effects may include venous thromboembolism, gallstones, hepatic toxicity, weight gain, dyslipidemia, and cardiovascular disease. Best practices for working with the LGBTQ plus population include fostering inclusive behaviors, addressing harassment and intolerance, providing a safe environment through visible supportive signs, and using their chosen names or pronouns. LGBTQ affirming therapy is an approach to psychotherapy that focuses on fostering empowerment and acceptance by helping patients navigate challenges effectively and teach self-compassion. A Pew Research Center analysis of Census Bureau data has found that in 2025, approximately 51.9 million immigrants live in the United States. Despite being more socioeconomically disadvantaged and facing structural and institutional inequalities in the United States, immigrants are paradoxically often healthier than the United States population. However, this health advantage diminishes over time due to assimilation of unhealthy, sedentary lifestyles and longer exposure to institutional and societal inequalities. In a study conducted by Makarem et al. 2025, Hispanic immigrants had worse overall cardiovascular health compared to non-Hispanic immigrants. Immigrants face stressors that are unique to the experience of migration that may exacerbate or cause mental health problems. However, access to mental health care by immigrants is at rates far below the general population, leaving them at risk of untreated mental health conditions. The Refugee Health Screener, or RHS-15, is a tool for screening refugees for emotional distress and mental health. The New Mexico Refugee Symptom Checklist, dash 121, is a comprehensive 121 item self-report instrument, used to assess various persistent somatic and psychological symptoms in adult refugees. The Hopkins Symptom Checklist is a 25-item questionnaire that assesses anxiety and depression in refugees. DSM-5 considerations for immigrant populations should include post-traumatic stress disorder, postpartum depression, depression or major depressive disorder, generalized anxiety disorder, panic disorder, adjustment disorder, somatization disorders, schizophrenia, and substance use disorders. Cat claw is a medicinal plant used by the Amazonians in South America for its immunostimulant and antiviral properties. It may inhibit the CYP3A4 isoenzyme, decreasing drug metabolism, which therefore increases the plasma exposure of antiretroviral agents such as atazanavir, ritonavir, and saquinavir. Make sure to ask what medications patients are taking at home, that may be herbs, supplements, or anything else like that that is not prescribed. Propanolol has been shown to have 53% to 76% higher clearance rates in Africans as opposed to Europeans. Felodipine is a calcium channel blocker, and the bioavailability of this drug is around 1.5 times higher in Mexicans than in Caucasians. Monitor blood pressure closely in any patients of Mexican descent who are taking this medication. A functionally deficient allele, CYP2B6*6, is more prevalent in Africans, 46.7% compared to Asians, 17.4%, which impacts the clearance of a medication called efavirenz, an antiretroviral medication often used for HIV treatment. Collaborative care, social integration, identify barriers to care such as cost, transportation, or distrust, offer community support services, ensure smooth access to pharmacy for obtaining medications, and options for improving the mental health of immigrants include providing national hotlines and crisis support in their native language. There are also options for low-cost therapy services with organizations such as the Open Path Psychotherapy Collective or the Place Within is another one. And I think that's it. Well, thank you for listening to my presentation. All right, have a good day.